Hi folks, this is Lila and Scruffy, and before I begin my surgery update video, I'd like to ask all my warrior prayers out there to please pray for the following YouTube friends. Please pray for Miss Free to You, who recently lost her Uncle Jerry the day before Thanksgiving. He was her uncle on her mother's side. So please pray for Miss Free to You and her family. Please pray for Miss Brazell, whose husband Walter is going through prostate cancer. Please pray for him. Please also pray for Kimberly Cochran, whose father has been very ill and also dealing with cancer. Please pray for him. Please pray for Maria Cisneros Toth. She will be having a upcoming hip surgery in the new year. Please pray for her that she gets through her surgery with no complication and heals completely. Please pray for Pam's doing it again, for her daughter Bree, who recently lost her baby girl, Jada, and also for Pam for losing her granddaughter, Jada, and their family. Please pray for them. Please pray for Reese World, her husband, who had surgery and that he is recovering well. Please pray for Tara Olson. She is pregnant with her second child and she has been dealing with lots of morning sickness and stomach issues and depression and sadness. During her first trimester, she's having a difficult time. Last time I checked, she is doing much better, but please pray for her that she will have a healthy pregnancy and her baby will be born healthy. And last but not least, please pray for Mrs. Jones, Loving Life Jones, for her father who has been very ill and in the hospital and dealing with health issues as well. So please, my prayer warriors, please pray for all these YouTube friends and anyone else who might need prayer. The next thing I like to say is thank you to every person who watched my surgery video and left a comment. Thank you so very much for your get well wishes, your encouragements, and your prayers. I enjoyed reading each comment while I have been recovering from my surgery on November 19th. And one more special shout out friends I'd like to thank for their emails, who personally sent me emails. Thank you to Maria Cisneros Toth, Becky of Becky's Life, Susanna of Suz What, Kim of Kim Ye 65, Tammy of Tammy Dunn, Pam from Pam's Doing It Again, and Tasha from Mrs. Jones Loving Like Jones, and Christina from My Kitchen Corner. Thank you, my friends, for sending me personal emails and for your prayers and checking on me. And also, I'd like to give special thanks to Mrs. Jones Loving Life, Jones, Tasha, and Dolores of the Baking Diva for putting their videos out there about their breast journey that they experienced. Thank you, ladies, for your videos. They helped me a lot. Also, a special shout out to Mrs. Free to You for mentioning me in her video and asking everyone to pray for me. Thank you so much, Miss Free to You. I love you. And to my good friend, Fran, out in Oklahoma, thank you for sending me the See's candy. She sent me a box of See's candy and some truffles. We did enjoy them very much. And also, I'd like to say thank you to Maria Cisneros Toth for being the first one to send me a Christmas card this year. Thank you so much. Okay, I know it's been like 11 or 12 days since my surgery on November 19th. So I'm just going to get it out of the way and tell you the good news. I do not have cancer. It said no carcinoma identified. I found out the news on November 27th, the day of my pre-op surgery appointment. I had to go and get my, my breast checked to see how it was healing. My breast is doing fine. I have no bruising, no swelling, no infection. And that's when they told me my results of my pathology report for my surgery. Now, I just want to talk real quickly about my day at the hospital. I went in on the 19th at 8:30, and I checked in, and they called me in around 9 o'clock. Now you go with the nurse, and they have a wheelchair waiting for you there. I got into the wheelchair, and she put this heated, warm blanket around my shoulders, and she wheeled me down from the main floor to the other side of the hospital to the mammogram imaging department. Then she, let them know I was there, and then I went into the room, and the two ladies there were going to do my prepping and imaging for my needle wire localization. That has to be done first before the surgery. So they gave me a robe and told me to go to the bathroom, use the restroom or whatever, and then undress from the waist up and put the robe open to the front. I did that, and I went back to the imaging room. They were then prepping the imaging machine there where they do your mammograms and take your pictures. And so they were setting it up and cleaning it up, and then she told me that the radiologist doctor will be coming in to insert the wire into my breast. Now, as you know, I already had one needle biopsy, and that was just so scary. But I got through that with no pain and no problems. And now I find myself standing there going to have a needle with a wire in it and a hook inserted to my breast. So let me explain how this works. So when there's a breast mass or an area of calcification, which was the problem with my breast, cannot be felt, a procedure called needle or wire localization is used to help identify the tissue for the surgical biopsy. So first the mammogram is done, then you're standing up there at the machine, so they put your breast between two plates to hold the breast still and also so you won't move. Then the nurse comes in there and she cleans the area of the breast with iodine to sterilize the area. Then the radiologist comes in and gives me a shot in my breast with a local anesthetic into the breast, and it numbs the breast in seconds. Then the doctor inserts a hollow needle into the breast, then places the tip of the needle in the suspicious area. Then a thin wire with a hook on the end is inserted through the hollow needle into the breast, alongside the suspicious area where they will be operating. The needle is then removed, leaving the wire in place as a guide to help the surgeon find the area of breast tissue to be removed. Now, I did not experience any pain. The only thing I felt was the prick of the needle, and that was it. So it sounds horrifying, I know. I mean, luckily I'm pretty strong tolerance of pain, and the fact too that you have to stand up, I think some women would probably faint. I did read on the internet about a lot of women said that they had horrible pain. It was very painful and traumatic for them to have that wire with the hook put in their needle. Um, Again, every woman is different. Also, it depends on the people that are working there, their experience, the radiologists, the nurses. They were all professional. They knew what they were doing. And they only had to adjust the needle or the wire about twice. And I felt like a little slight pulling, but nothing, where I was, screaming in pain or being tortured. I know it sounds worse than it was. And for me, it was okay. So after that, they taped up, left the wire there sticking out. Now, I didn't look. I just looked at the wall. I didn't want to see anything. I didn't want to look at nothing. I just wanted it done. So they, patched me up, put me back in the wheelchair. And oh no, they had me get dressed. I'm sorry. They had me get back dressed. And I was fine. And then they wheeled me back to the other side where I would be checking in at my station. So they took me to my station. There was my bed and a chair and all the machinery there. And they told me to undress completely. I had to take everything off and put on the socks and the cap that they give you, and the robe would be open to the back. So I did that, got in the bed. Then the first nurse came in and she did my IV, and then the second nurse came in and she did all my hookups, to the back for the 8 kg blood pressure, pulse, and all that good stuff. She did that. They put it on the back, on my upper back, because I would be having surgery in the front. And then finally, the real nurse came in who would be with me all day long, came in, and we went through a bunch of things on the computer, medications, any problems with, allergies, things like that, all the questions they ask you. And that was it. So I was just, there in the bed. And I told my husband to go home. We only lived 10 minutes from the hospital, so he went home, and he can come back later. Well, anyway, as time went by, the surgery didn't happen. So in the meantime, I was just, there in the bed all day. So finally, let me see, around 2 o'clock, they finally called me. It was my turn to have my surgery. Had the surgery, and I woke up a little bit, I think almost 4 o'clock, and I was very, very sick. I had a very rough recovery. I wasn't sick from the surgery. I was sick from all the pills they gave me and the anesthesia. And when I had came to, I told the nurse I want to go home at 5 o'clock because I was feeling so bad. I thought, well, let me give myself another hour because I was really, really out of it when I woke up. And so she had asked me if I wanted something to eat. And I go, no, what do you have? And she goes, would you like a Jello? I said, yeah, let me have a Jello cup. So she gave me a Jello cup and a cup of ice chips. And I ate the Jello, and it tasted so good because I was so hungry. I hadn't eaten since the night before, and it was already 4 o'clock. So I've been all day long without any kind of food or drink. So again, like I said, the surgery site, that was not the problem. It was my stomach and my head. I had a horrifying, throbbing headache. Felt like a migraine. I felt like my brain was going to explode. I was in such pain. And they had prior given me some pills. They had given me like all these pills. And I think too that's what made me so sick to my stomach. So anyway, I finally decided, okay, I'm gonna get dressed so I can go home. So another nurse came in and she helped me get dressed. She was really professional with how to dress you. I mean, she did it in like 2 seconds. So I was dressed and, got up, and my husband was there already. And I got into the wheelchair, and they wheeled me out to the car. So we're driving home, and I was telling my husband how awful I felt, and I just wanted to hurry and get home. So we're like almost 2.5 blocks away from home when I told my husband, pull over, I have to throw up. So I vomited on the curb violently. I just vomited. And then I closed the door, and I said, okay, let's go, we're almost home. Then about a few feet away, I said, oh my God, pull over again. And I threw up a second time. So I almost made it home, without throwing up, but I threw up twice, and it was awful. It was just awful. I was so sick to my stomach. So I get home. I'm so glad to be home. It's after 5 o'clock. I'm exhausted. I'm hungry, and I was very, very agitated when I woke up from the surgery. Very, very agitated, and also because I was still heavily sedated. I really was, but I just wanted to go home. So anyway, I came home and I went into the bedroom and I changed my clothes right away. But I was very, very nauseous, very, very nauseous. But I didn't throw up. But I was just these waves of nausea were just going through my stomach. So I very light chicken sandwich or turkey sandwich and chicken noodle soup and some crackers and water. And then I was out. I went to bed at 8:30, and I had a trash bag there next to me because in case I had to throw up and I couldn't make it to the bathroom, I didn't want to throw up all over my bed or myself. But I didn't throw up, but I was nauseous. So anyway, I'm gonna stop this video for a minute, and then I'll continue with part two. So please come back for part two. Okay, folks, I'm back. This is part two of my surgery update video. Anyway, so I woke up the next morning, you guys, and it was the worst. and I mean the worst. I guess because the anesthesia wore off, the pills wore off, I woke up in severe rib and stomach muscle pain. I literally could not breathe. My throat was killing me. I haven't had sore throat or any kind of problems with my throat, sickness, coughing, nothing in like 28 years. I kid you not, honest to goodness, honest, till that morning, the next day when I woke up. Oh, it hurt to swallow. I was when I tried to cough, I almost died. It was so painful. I didn't understand it, why my body was so sore, why my ribs and my stomach muscles, I mean sore. And so I got up and I still had a little bit of a headache, but not as bad. And also the night before when I took the pills that the surgeon had gave me, they did not help me at all. They made me even more sick to my stomach. So I had to quit them. I took like two pills, and I noticed each time I had that same sickness. So those pills were no good. I just, just put them to the side. But I did have some remaining uh, medicine from my hysterectomy surgery. So I took those, and those were okay. They helped me with the pain. But that stomach and rib pain and throat pain was the worst. So I had got up to plug in something, and when I bent over, I had this horrendous, horrible feeling of soreness and pain in my ribs and stomach. I felt my stomach and my ribs like went forward, and I just couldn't breathe. I literally just stood there and held onto the dresser. And I called for my husband and I said, I think we need to go to the emergency room. This is not right. And my husband said, no, no, no. He goes, you're probably just sore from the surgery. You were intubated, and then you threw up really hard. And that probably caused all that soreness in your stomach. And I said, well, I had the same kind of soreness when I had the hysterectomy. And it wasn't even this bad. I had it for like, 1 day. So anyway, so I listened to my husband. I said, okay, I won't go to the emergency. I'll wait it out. So I just stayed in bed Wednesday and Thursday. Friday, I woke up, had some oatmeal, and I started to feel a little better. And it wasn't until Saturday, okay, of that week that I started to feel much like myself. The rib and stomach pain were gone. My headache was gone. Nausea was gone, and I started to feel less agitated, and I could think clearly. And I really do think it was because I had just gotten out of surgery. I wasn't fully out of it yet, and I went home a little too soon. But you know how it is. You just want to go home. I didn't want to stay there. So anyway, so after Saturday, I've been okay. My throat pain is all gone. I got my voice back. I coughed up a lot of phlegm and stuff, but the intubation is the worst. I hated it when she told me that they were going to intubate me. I don't like that at all. It was really bad this time. I had the same problem with the hysterectomy when they intubated me, but it wasn't nearly as bad as this. This was really, really rough. And also the nausea and you know, the sickness I felt was really hard on me. So that's why it's been taking me a while to get back to update you all. But like I said, my pathology report came back with no cancer, and I am just so excited and happy. And it was the best Thanksgiving gift and early Christmas gift I could ever ask for and receive. So, um, as you know, this was a very, very stressful and scary journey for me dealing with this possible breast cancer, pre-cancer uh, on my right breast. It was just, I can't even still believe that this happened to me. So I just wanted to let you all know that I'm okay and I'm fine. And I just want also to tell you ladies again, go get your mammograms. Now, just look at me. I didn't have lumps or cysts or anything abnormal in my breast, but yet they still found something there in the tissue. So just because you don't feel a lump or a cyst or have nipple discharge or bleeding in your nipple doesn't mean that that there might possibly be cancer, because you cannot feel it. And that was what the problem was with me. Now, I had been told by 3 different people before I had this surgery that I didn't have breast cancer because normally when you have breast cancer, you have a lump, okay, or a cyst. So that's what was so difficult for them to assess whether I had cancer or not, was because there was no lump that they could see or assist on the imaging, okay, the diagnostic imaging. And that's how they find your cancer. They see a lump or, a cyst or something there. But because I had microcalcifications, they are seen but not felt, okay? And like I said earlier in my other video, they are an area of concern when there is a line of calcifications, or a cluster, meaning a group in one specific area. And that's what I had on my right breast, was a cluster of calcifications. And sometimes those can be precancer, okay? Not cancer, but precancer. And that's why when the needle biopsy didn't work, that's why they had to go to the second step, which is a surgical biopsy. And that's what I had. They took out, had to open the breast, like a fillet, and, go in there and take out the tissue. And that's guaranteed 100% you're going to know, okay? So that's what happened to me with my breast cancer scare. I hope this will encourage you to get your mammograms, do your self-examination once a month, um, and just, take care of your health. Don't ignore it. Even if you think it's might not be nothing, go get it checked out. Don't even, believe me, they want to see you. Cancer can be cured if it's caught early. But I was just so terrified, horrified, because I had just went through uterine cancer. So you can understand my worry and concern. So anyway, that's all I want to share with you. So I hope this video was helpful. Um, I'm sorry it took too long. I had to do 2 parts. As you can see, I got my tree decorated finally. I got my little reindeer there. I got a hanger up on the wall there. And I still have tons of stuff to do. So I like to wish everybody a happy Thanksgiving. I know it passed already. I hope you all had a wonderful Thanksgiving. It's now December 1st. And I'm really, really looking forward to celebrating Christmas this year more than ever. So this is Lila and Scruffy saying thank you so much for watching our video and sending Kelly love.